Did you realize that you need an official Tennessee certificate, I know you know this, of immunization required for entry into school? So it is the season, time for kids going back to school, and immunizations are just a must. Tell us why they're so critical, Tatum.
Immunizations are important for all children given age 6 weeks and up, and it protects them from potentially deadly diseases.
Let's go over some of the illnesses that they're being protected from.
So infants as old as 2 months can get their DTaP, which protects them from pertussis, which is what we worry about a lot, polio, hepatitis B, Haemophilus influenza, pneumococcal disease, and then as they get older they'll get hepatitis A, varicella, and MMR.
It seems like there are just so many. Now when you get to the kindergarten age, obviously there are different immunization requirements. What are some of those, and why are they so important also?
So kindergartners typically age 4 to 6 when they receive those doses, and their booster doses. So they'll get their DTaP booster, the polio, hepatitis A, if they've not previously completed that series as an infant.
Okay.
And then they'll get the MMR and the varicella, which is chickenpox.
The MMR, I'm reading on the screen, the measles, mumps, and rubella, of course. And what's the next to the last one? The varicella?
Varicella, that's the chickenpox.
Chickenpox one, okay. All right, we're talking a little bit before we started the interview about the numerous vaccines that kids have to have today, and it seems like they have increased over the years. Is that my imagination, or are the requirements going up for more and more immunizations?
Right, and it's not just we want to, inject the kids so many times. We just want to protect them from these diseases, and we're finding that, the booster dose at 4 may kind of wear off later, so that's why the 7th graders are required to get the Tdap, which is the booster dose of tetanus, diphtheria, and pertussis. And we even recommend that vaccine for new moms and dads and grandparents to protect the newborn who can't be vaccinated for several weeks, so that they don't get exposed to a disease. In
case there's someone around them in the household, or when they're out and about.
Because adults can have pertussis and maybe not know it, and then the infant, the newborn baby, could get the disease, and it's very, very possibly deadly for newborns. So
very critical. Can the children can survive?
They can. They can recover, but they have long-term effects.
Really? Do you see that much today in this city?
Surprisingly, we do still see these vaccine preventable diseases.
You do?
And we have a whole program at the health department that monitors that, and we go out and respond to any kind of active case.
Okay, so are there educational programs? I would think there would be through Metro Health to educate people throughout our area, Middle Tennessee. Can you tell me a little bit about that?
Well, our immunization program goes out to all the private doctors and make sure they're storing and handling their vaccines correctly. We also have an outreach program that encourages parents to get their kids in for all their regular physicals. And of course, they're going to get their vaccines at that time too when they're needed. And then each time a parent brings their child in for shots, we give an information sheet on every vaccine that they receive, and it kind of goes over what the disease is, what the symptoms might be, what the side effects could be from the vaccine, and that kind of stuff.
I see, and to allay fears and concerns.
Yes.
Okay. You mentioned the kindergarten immunization requirements. We also, I think, have a list, and if you could go over again those 7th grade immunization requirements. You said there's some boosters there.
The 7th graders need the DTaP booster, and they also could possibly need the varicella, which is chickenpox, if they didn't complete the series earlier. And then we recommend the meningococcal and the HPV vaccine for boys and girls in that age group.
Okay, all right. You do hear also about when kids go off to college, if they haven't had the meningococcal one before they go to college, you recommend that as well? When you're living in close quarters, I remember doing stories when I was a medical reporter on devastating cases of meningitis among some college students.
So we try to catch the kids as early as we can and vaccinate them before they're exposed. So we will give the first dose at 11 to 12 years old, and then they'll get a booster dose before they go to college.
Okay, as we wrap up in our last minute, what are your clinic locations and the hours?
Right, we have 3 preventive health locations. We have one at Lentz, which is not far from here, and we have one on Trinity Lane in East Nashville, and Woodbine is in South Nashville.
And I see the hours are pretty nice hours as far as 8 to 4:30 at Lentz. I'm seeing.
Yes.
Okay.
East is 7:30 to 4:30, and Woodbine is 7 to 4:30. They do walk-ins for immunizations, and they usually take their last walk-in at 3:30 every day.
Okay. Do you take appointments?
We usually take appointments only for our family planning services.
Okay.
So immunizations are walk-in Monday through Friday.
All right. Okay, Tatum, thank you so much. I know you want to allay those fears and tell people that they need to get their kids in to prevent a lot of critical illnesses.
Yes.
All right. Thank you so much for taking the time. Appreciate it.
Thank you.
All right, and we'll be right back after this. Thank you for watching Community Health Matters. Learn more ways to improve your health at mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.